flexion. So the athlete is going to lie supine. Their arm is going to be 0 degrees in flexion and extension. You're going to want their shoulder in full external rotation and their elbow fully extended with their palm facing anteriorly. You're going to want to put the center of the fulcrum on the AC process. The stationary arm is going to be aligned with the sternum, and the moving arm will be aligned with the medial epicondyle. You'll want the athlete to move or actively abduct their arm as you move the moving arm along with it until they can't reach it any longer. And the normal range of motion is usually 0 to 180. Okay, so the next one we're doing is elbow flexion. Your athlete is going to be supine. The arm is in 0 degrees flexion, extension, and abduction. You want their elbow fully extended and the arm in supination. You're going to align the fulcrum over the lateral head of the humerus. Your stationary arm will be aligned with the acromial process, and your moving arm with the radial head or styloid. So as they actively flex their arm, and then your normal range of motion will be 0 to 145. Okay, so the next one we're going to do is wrist extension. You want your athlete seated. Their arm is going to be supported by the table, and your elbow at 90 degrees flexion. Their palm is going to be facing the floor, and with their supported, or with their free hand, they're going to support their arm to avoid any radial deviation. You're going to put the fulcrum aligned with the ventricular. Your stationary arm will be aligned with the ulnar styloid and olecranon process, and then your moving arm with the midline of the fifth metacarpal. As they extend, you're going to look for that range of motion, and the normal range of motion is 0 to 70 degrees. Alright, so the next one we're doing is the finger abduction at the MCP joint. You're going to have your athlete seated, their forearm and hands supported, fully pronated. Your wrist will be in 0 degrees flexion extension, and your radial ulnar deviation should be 0 degrees as well. Your MCP should be in 0 degrees flexion and extension, so it should just be relaxed. The fulcrum will be at the dorsal aspect of the MCP joint. Your stationary arm will be dorsal midline of the metacarpal, and your moving arm will be dorsal midline of the proximal phalanx. So as they move in abduction, you'll record it, and the normal range is 0 to 90, but the average and normal is about 45 degrees.
Okay, so we're going to be measuring the distal interphalangeal extension. You're going to place the wrist in a neutral position. It will stabilize the MCP joint, and the PIP joint should be flexed to 70 or 90 degrees. The fulcrum will be aligned over the DIP joint. The stationary arm of the midline of the middle phalanx, and the movement arm over the midline of the distal phalanx. So the patient will attempt to extend the DIP joint, and you will move the stationary arm. Normal is 0 degrees of extension. We'll be assessing thumb opposition. The forearm should be in full supination, the wrist in 0 degrees flexion, extension, or deviation. I will stabilize the fifth metatarsal, and full range of motion is the tip of the thumb touching the crease of the fifth. If this is impaired, it's going to be less than 8 centimeters, which will be measured with a ruler from the tip of the thumb to the crease of the fifth. Now we'll be doing hip flexion. The patient should be laying supine with legs fully extended. The fulcrum will be placed over the greater trochanter, the stationary arm, the lateral midline of the thorax, and the movement arm of the lateral midline of the femur in line with the lateral epicondyle. Patient will flex the hip. Normal range of motion is 100 degrees.
Okay, we are going to do thoracolumbar extension using a tape measure. For this, we're going to start by making a mark at spinous process is C7 and T2. You're going to measure that distance with the tape measure and record that. And you're going to leave the tape measure in the position as the athlete moves. So you're going to get the athlete to move into full extension, thoracolumbar extension. And that distance should change. Still measuring at the C7 and S2. You take that measurement as well, And the difference between the measurement is the measure of the angle of motion, degrees of motion. And the norm for this is 20 to 30 degrees of motion. Okay, next we're going to use the double inclinometers to measure cervical lateral flexion. And as with thoracolumbar extension, we're going to be measuring active range of motion here. So to start off, one of the inclinometers is going to be placed on the T1 spinous process and the other on the top of the head. You want to make sure that both are at 0. And next we're going to ask the athlete to move into full lateral flexion of the neck without moving the trunk. And once we get that measurement, we're going to take the difference between the two, and the norm for this is 45 degrees. Last, we're going to do cervical flexion with the use of the universal goniometry. The patient starting position for this is we're going to make sure that he's in 0 degrees of rotation or lateral flexion of the neck. We're going to take our goniometer, and our fulcrum is going to be placed over the external auditory meatus with the stationary arm perpendicular to the ground, and the movement arm is going to be parallel to the nares. With this, you can also use a tongue depressor and put it in the patient's mouth and make sure that the movement arm is parallel to that. Next, we're going to get the athlete to actively flex the neck. And we're going to take a measurement from there. And the norm for this is going to be 40 degrees.
So for this test, we're going to be measuring ankle inversion and eversion. And for inversion, we're going to align the stationary arm with the tibia. And we're going to have the movement arm aligned with the rest of the foot. So I'm going to ask you to invert your foot. And as we do that, we're just going to realign it with the foot. And the normal ranges for that one for inversion is anywhere from 0 to 30 degrees. And then for ankle eversion, I'm going to ask you the same alignment with the tibia and in between the medial and lateral malleolus. And so now I'm going to ask you to evert your foot, realign it, and normal ranges for that is anywhere from 0 to 20 degrees range of motion. So for this test, we're going to be measuring hip external rotation. So we're going to put the fulcrum on the patella, and then the stationary arm is going to be down at the aligned with the tibia, and then the movement arm is just going to follow the leg inward for external rotation. So I'm going to ask you to move your leg this way, inward. And then we measure it. And normal ranges of motion are anywhere from 0 to 50 degrees.